when is too young too young? And we have patients coming in for fillers in their face, their lips, who are in their late teens. More and more 20-somethings are coming in to have Botox and fillers. And I think that my own personal philosophy on this has changed a little bit. I think some of the requests are inappropriate. I think when a 21-year-old comes in and wants her folds completely filled in, and they don't even extend to the corner of the mouth, she's reverting back to when she was a baby, not when she was a teenager. And I think that that's inappropriate. I think that you always have to remember what you're trying to do and create naturalness. When a 22-year-old or 25-year-old comes in and they've been frowning since they were 10 and they start to have a frown line and it's deep, they may not only need Botox, but they may need fillers at that age. And so that's totally appropriate. I get a lot of 20-somethings who come in and are doing some maintenance Botox because early in their family history, they get very deep lines between the brows. I think that's appropriate. So I think that, whereas I probably had a philosophy 20 years ago of not treating anybody under 30 with Botox and fillers, I think now you really have to take it on an individual basis, and some of it's very, very appropriate. So I think it's important to be honest with the patient. I think you really have to evaluate their age and what they're asking for. Is it appropriate for a 15-year-old to want lip enhancement? These are some of the ethical questions you have to ask yourself. But I think 20-somethings are now more and more asking for Botox and fillers, and in many of the cases, it is an appropriate treatment.